The World Health Organization as well as the U.S. Center for Disease Control have issued warnings about the resurgence of measles in Europe and the States. So the question is, should Canadians be concerned?
We need to be prepared. We absolutely need to be prepared. This is one of those infections where we have to have maintained vigilance to maintain those very high vaccine rates, because there's not a lot of wiggle room with measles. It's extremely transmissible, and if your vaccine rates get a bit lower, you'll start to see explosive outbreaks.
Infectious disease specialist Dr. Isaac Bogosh says the vaccination rates against measles in most of Canada are above 90%, but we cannot get complacent.
And unfortunately, we're in an era where more and more people are choosing not to vaccinate themselves or their children. This is a huge problem. And if we see that persist, we're going to see outbreaks of vaccine-preventable illnesses. We've seen over the last few years a lot of polarization, a lot of disinformation, and I think the key thing here is really building and continuing to build trust in public health programs.
He adds that newcomers to Canada should also be mindful of their measles vaccination status.
And there's so many people who have moved to Canada from other parts of the world where perhaps the public health systems aren't as robust. Some of those people might already be immune to measles because they've had an infection in the past, but some of them might not have been. And it's really important that all Canadians, especially new Canadians, are up to date on their vaccines.
And when you do get vaccinated, Dr. Bogosh says it's vital to make sure you receive the complete series of shots.
It's important to note that in 1996, a second dose of the measles vaccine was added. There were lots of catch-up campaigns to ensure that people had the 2 doses of vaccine, but there are still some people that might have 1 dose of a measles vaccine. They might think they're fully vaccinated, but they're not. And some of those people might be susceptible to measles.
And even with dedicated efforts, he says we're not going to be 100% measles free.
Listen, there's a guarantee that we're going to import measles. We have. There's lots of cases of measles all over the world. We live in an era with unparalleled human mobility, and certainly we've seen imported cases of measles in Canada in the past years, but it's going to happen. The key thing here is we can control what happens in our country. We can ensure that Canadians have easy access to measles vaccines and other vaccine-preventable illnesses. We have high rates of vaccination, so we can avoid any outbreaks should, or actually when, a case of measles lands in our soil.
Now, Dr. Bogosh reiterates that measles should not be taken lightly. It is a dangerous infection in and of itself and can also wipe out pre-existing immunity to other infections. So he says the bottom line is check to see if you're immune, and if not, get those vaccines. For City News, I'm Dilshad Burman.